Acute orthopedic infections, which often present as emergencies, include acute osteomyelitis, acute septic arthritis, acute pyomyositis, acute on chronic osteomyelitis, and acute on chronic septic arthritis. Acute osteomyelitis and septic arthritis can coexist in the same individual. They are more common in children and in patients with sickle cell disease. When the diagnosis is made in an adult, it is important to exclude immune suppression. Staph aureus and staph epidemic, this accounts for the majority of the infections. The commonest route of infection is hematogenous and may originate from skin lesions and ENT infections. It is important to cover empirically with appropriate antibiotics without necessarily waiting for the culture and sensitivity report. The causes are staph aureus, staph epidermidis, salmonella, is common in sickle cell disease, Haemophilus influenza, strep pyogenes, strep ficalis, Escherichia coli, open fractures, iatrogenic from implant surgery, joint aspirations, femoral vessels, procedures, intraosseous infusions and transfusions, umbilical vessel catheterization. The symptoms are fever, pain, inability to move affected limb, swelling, lethargy, refusal to feed, as in children. And signs that are usually elicited are febrile, swelling, inability to use the limb. Investigations are FBC, ESR, sickling, CRP, blood culture, X-ray of affected parts, ultrasound scan of affected parts, which may also be used for guarded aspiration, gram stain and culture of aspirates, MRI if available, radio nuclide scans. Main treatment objectives are to eradicate infection, to prevent development of chronicity, prevent complications. Non-pharmacological treatment includes splinting, ultrasound guarded aspiration, incision and drainage. Pharmacological treatment, anti-infective therapy. First line treatment, give clozapine IV in adults 500 milligrams 6 hourly for 2 to 4 weeks. In children 5 to 12 years, you give 250 milligrams 6 hourly for 2 to 4 weeks. 1 to 5 years, you give 125 milligrams 6 hourly for 2 to 4 weeks. And less than 1 year, you give 62.5 milligrams 6 hourly for 2 to 4 weeks. Then he gives ciprofloxacin IV to be administered over 60 minutes. In adults, 400 milligrams 8 to 12 hourly for 14 days. And in children, 10 milligrams per kilogram with a maximum of 400 milligrams 12 hourly for 14 days. You monitor BUE creatinine and perform auditory examinations weekly while on gentamicin. The second line treatment, you give clindamycin IV in adults 300 milligrams 6 hourly for 7 days, and children 3 to 6 milligrams per kilogram 6 hourly for 7 days. Or you give amoxicillin clavulanic acid IV in adults 1.2 gram 12 hourly, increased to 1.2 gram 8 hourly for 7 days in severe infections. In children 12 to 18 years, give 600 milligrams to 1.2 gram 12 hourly. It is increased to 1.2 gram 8 hourly for 7 days in severe infections. For 3 months to 12 years, give 30 milligrams per kilogram 12 hourly, increased to 30 milligrams per kilogram 8 hourly for 7 days in severe infections. 7 days to 3 months, give 30 milligrams per kilogram 8 hourly for 7 days. Preterm and less than 7 days, give 30 milligrams per kilogram 12 hourly for 7 days. For individuals with penicillin sensitivity, first line treatment, you give clindamycin IV in adults 300 milligrams 6 hourly for 7 days. In children 3 to 6 milligrams per kilogram 6 hourly for 7 days, and gentamicin IV in adults 40 to 80 milligrams 8 hourly for 14 days. In children 1 to 12 years, give 2.5 milligrams per kilogram 8 hourly for 14 days. In less than a year, give 2.5 milligrams per kilogram 12 hourly for 14 days. For individuals with sickle cell anemia, you give clozaceline IV in adults 500 milligrams 6 hourly for 2 to 4 weeks. In children 5 to 12 years, you give 250 milligrams 6 hourly for 2 to 4 weeks. 1 to 5 years, you give 125 milligrams 6 hourly for 2 to 4 weeks. Less than a year, you give 62.5 milligrams 6 hourly for 2 to 4 weeks. And then you give ciprofloxacin IV in adults 200 to 400 milligrams 12 hourly for 2 to 4 weeks. And in children 10 milligrams per kilogram 12 hourly for 2 to 4 weeks. For analgesia, the first line treatment, they give ibuprofen oral in adults 200 to 800 milligrams 6 to 8 hourly, the maximum of 2,400 milligrams daily. In children 10 to 15 milligrams per kilogram 6 to 8 hourly, and the maximum of 40 milligrams per kilogram daily. Or diclofenac oral in adults 50 milligrams 8 hourly or 100 milligrams 12 hourly. In children more than 12 years, you give 50 milligrams 12 hourly. Less than 12 years is not recommended. Diclofenac IM in adults 50 to 75 milligrams 8 to 12 hourly with a maximum of 450 milligrams daily. In children is not recommended. Or you give morphine oral in adults 15 to 30 milligrams 4 to 6 hourly as required. Children 200 to 500 micrograms per kilogram give 4 to 6 hourly as required. Or morphine IV or IM in adults 2 to 5 milligrams 4 hourly as required. In children 50 to 200 micrograms per kilogram 4 hourly as required. Or codeine oral in adults 15 to 60 milligrams 4 to 6 hourly as required. In children is not recommended. And for control of fever, you give paracetamol oral in adults 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, you give 250 to 500 milligrams 6 to 8 hourly. 1 to 5 years, you give 120 to 250 milligrams 6 to 8 hourly. 3 months to 1 year, you give 60 to 120 milligrams 6 to 8 hourly. Or you give paracetamol IV in adults having weight more than 50 kilograms, to give 1 gram 6 hourly as required. Less than 50 kilograms, to give 1 gram 8 hourly as required, with a maximum of 3 grams daily. Children 12 to 18 years with weight more than 50 kilograms, to give 1 gram 8 hourly as required, the maximum of 3 grams daily. And 12 to 18 years with weight less than 50 kilograms, give 15 milligrams per kilogram 6 hourly as required, with a maximum dosage of 750 milligrams per dose. And 2 to 12 years with weight less than 50 kilograms, to give 15 milligrams per kilogram 6 hourly as required, on a maximum dosage of 75 milligrams per kilogram per day. So referral criteria: refer to an orthopedic specialist if there is a collection of parts or no improvement in 36 hours.